Council, City Manager, staff, and public. My name is Yoli Diaz, Executive Director of CARE, Cancer Aid Resource and Education. My goal today, because it's the third time that I've been here, is really trying to get a meeting, really to get a focus on the healthcare fund and to address the issues that exist. I said it before, and I do think that you all need to go back to the table with the county and address this problem. I recently had another lady call me who couldn't get in for testing at Memorial Medical Center because they wanted way too much money. Actually, they wanted her deductible, and actually more. They wanted $6,000. And sadly, she will not get her test now in El Paso until July. So what I want to do is at least, please, I welcome any of you to contact me. And yes, thank you, Mayor, for the conversations we've had. What I'm going to do now, because I know I only have 3 minutes, I am going to read straight off of a report that came out when the county got the 2005 Achievement Award, National Association of Counties Best in Category Health. And I'm going to provide this to you all by email also, but what it says here is access to care. Provide care for all, regardless of ability to pay, preserve and enhance key services, continue community accountability. Access to care of primary concern was that Memorial Medical Center be maintained as a full-service acute care hospital by sustaining and enhancing substantially the same service lines currently offered. Diminished services, especially those most crucial to the underserved populations, would not meet the objective of the people. Likewise, the people made it clear in meetings and interviews that access for those unable to pay must be preserved. Finally, the new leadership of the hospital must integrate with and provide leadership to the continuum of community care, including federally qualified health centers, veteran services, healthcare for the homeless, and other outreach programs. And I'm going to go on as far as I can off of this section of the lease between Memorial Medical Center and the city and the county. Section 6.5, there's 13 volumes. This is volume 2, I think part 1. Indigent care continuation of services. A, lessee agrees to institute and maintain during the term or any extended term policies for the treatment of indigent patients, those unable to pay the full cost of healthcare services rendered to them, which taken as a whole are no less favorable to the residents of the city and county than those presently maintained by MMCI. Lessee within 90 days of closing will provide a copy of its written policies on indigent care to lessors. And that's my time, but please, I welcome you to contact me so that I can meet with you, answer any questions, because doing nothing is not the answer. I appreciate it.
Thank you. Okay, anyone else on the 7th row?